تقدر تحطني كوهوست عشان أسجل؟
اه حمزة انت كو هوست هلا.
يعطيك العافية.
تمام عيني.
تمام، يعطيك العافية.
Today we'll talk about viruses and some parasite diarrhea. You know, diarrhea, al-ishal, is part of the gastrointestinal tract module. So the learning objective to identify and characterize important viruses Rotaviruses, viruses, Astroviruses, and to lesser extent, we are going to give you some hints regarding the mechanism of infection, antibody response, control, and then we are going to talk about some parasites regarding Giardia, lamblia, Cryptosporidium parvum, and Balantidium. Just short hints. With viral gastroenteritis is inflammation of the stomach, could be small intestine, could be large intestine, associated with vomiting or diarrhea or both, which can be caused by many viruses, as I said. Rotaviruses, Caliciviruses, Astroviruses, النجمية, Astro من النجم, and Adenoviruses. It could be acute diarrheal illness, disease very rapid. It can start and resolve within several hours and may last sometime to a few weeks, less than 3 weeks, the acute one. Viral diarrhea was previously a diagnosis of exclusion. يعني احنا كيف نعرف هذه؟ نعمل exclusion للبكتيريا للباراسايت. Nowadays we have some diagnostic tool, enzyme immunoassay, EIA, PCR, polymerase chain reaction. These tools are very powerful in the diagnosis of viral gastroenteritis. And we are going to compare between the different viruses, and you have to know every point in this table. This is not table, this is text. So the viruses that I am going to talk about them during this lecture are rotaviruses, caliciviruses, astroviruses, and adenoviruses. Regarding the nucleic acid, Rota, double-stranded RNA, single-stranded RNA, adenovirus, double-stranded DNA. Regarding the diameter, I don't want from you the figures, but look, caliciviruses and astroviruses are small viruses. The other two are large viruses. Replication in tissue culture, rotaviruses usually incomplete. Other, not important point. The number of serotypes also not important. Now, the pathogenic, where the infection can be seen, rotavirus, duodenum and jejunum, mainly duodenum. Calicivirus, jejunum. Astro small intestine, adeno small intestine. So rotavirus in the beginning of the intestine. Regarding the mechanism of immunity, here rotaviruses by secretory local IgA, while the others not known. Endemicity or epidemicity, epidemic and sporadic rotavirus. It come in epidemic. Caliciviruses, family or community. The others are sporadic cases. يعني هنا وهناك. Seasonality, rotaviruses, winter. The rest, none known. Ages is also very important. Rotaviruses, the infection below 2 years. And this you can expect it in clinical scenarios. If I say to you an infection occur in a child less than 2 years of age, you will expect rotavirus. Older children and adult caliciviruses. Infant children adenoviruses. So you will get hint. If I say to you adult, you should think of calicivirus. All of them fecal-oral route transmission. The incubation period is also very, very important. Incubation period of rotavirus, 1 to 3 days. Calicivirus, 0.5 to 2 days. Astrovirus, 1 to 2 days. Adenoviruses, 8 to 10 days. So if you of 7 or 8 days duration, 9-day duration, what do you say to me? Adenovirus. As I said, the major diagnostic, these are the major diagnostic ways that I have mentioned: electron microscope, PCR, enzyme immunoassay, and so forth. So this table, please pay attention to it. And we are going to go through it during our discussion also. روتافيروسز زي العجلة. روتا ليش يسمى روتا؟ زي العجلة. This is Calicivirus, we say the small virus. أسترو زي النجمة، عندها بروزات. فلو شوفتك هذه البيكتشر تقول لي أستروفيروس. Starting with rotavirus. Most common, 40 to 60% of winter acute gastroenteritis. The age, less than 2 years of age. And I did mention this. Vaccine is available now against rotavirus, which has been discovered 1973. Discovered and developed, manufactured in 2006. يعني من 2006 هذا الفاكسين موجود. فإذا لو سألنا عندنا فاكسين ضد الروتافيروس، الجواب نعم. Common feature of Rota incubation period. حكينا قديش incubation period 1 to 3 days. Fecal oral route transmission. The patient will have vomiting before diarrhea. That is why it's called stomach flu. Influenza المعدة. And the diarrhea, there will be no pus, no mucus, no blood in the stool. If you see pus or mucus or blood in the stool, this is not rotavirus. Now, virology of rotavirus, the family Rheoviridae. حكينا أي كلمة بها viridi, أي suffix viridi, it means family of a virus. Rheoviridae. It has 11 segment double-stranded RNA virus. The protein that it has, 6 structural and 6 non-structural. Structural viral protein, non-structural, non-specific protein, 1 to 6. Just to keep it just in mind for information. Pathogenesis where? in the duodenum, proximal duodenum. There will be blunting of intestinal villi and destroy the villus cells. And this virus can produce enterotoxin. Remember that rotavirus has got, and that is why it causes diarrhea. Manifestation incubation period, as I said, 1 to 3 days. If it is severe, may produce severe dehydration. The dehydration may lead to death, particularly in very small and malnourished children. The short incubation period in which there will be vomiting, watery diarrhea, and this vomiting and repeated diarrhea may lead to dehydration. Diagnosis with these procedures that I have mentioned: electron microscope, enzyme immunoassay, and real-time PCR. Treatment: no specific treatment for viral infection, just a fluid and electrolyte replacement. Hygiene, of course, very important to control such infection. And the live oral vaccine is very important and is available and recommended for infants. Of infants we use at the age of 6 to 14 weeks. يعني شهر ونص إلى 3 أشهر ونص. دوسز بالشهر الثاني، بالشهر الرابع إلى plus minus 6 months. يعني نعطي الجرعة الأولى بالشهر الثاني والجرعة الثانية بالشهر الرابع. بالشهر السادس plus minus تعطيها. A protection very high, above 85%, almost full of protection, up to 98% protection with this very effective vaccine. Now we come to clinical capsule. Worldwide يعني كلش منتشر هذا الفيروس. Death of infant about 1 million per year. بأمريكا بحدود 100 وفاة سنويا. These viruses are still major cause of severe illnesses. Vomiting, abdominal cramps, low-grade fever, followed by watery stool, no mucus, no blood, no pus. These are the main characteristics, but we cannot differentiate in the acute stage between this infection and Calici, Astro, and Adenoviruses, except with those hints that I have given you regarding the period and the others. But regarding the diarrhea itself, we cannot tell. We come to the Calicivirus, Calciviridae. The genera Norovirus. Sometimes we call it Norwalk. Norwalk مدينة في أوهايو بالUSA. فيسمى الفيروس أحيانا نوروك اللي هو نورو virus is sapovirus. We are not going to talk about sapovirus, just for norovirus, Norwalk. Now, noroviruses, small rounded, naked, icosahedral, RNA, hard viruses, resistant to acid, ether, and heating. These viruses can resist 60 degrees centigrade for 30 minutes. يعني أحيانا واحد يقول لك خلينا نحر أو بالأسيد كذا. This is hard virus. 4 serotypes cannot be grown in cultures, and we mentioned that cannot be grown in culture. Transmission by fecal-oral route, usually older children and adult. This is versus rotavirus. We said less than 2 years of age. Pathogenesis is similar to rotaviruses, but without enterotoxin. This virus has no enterotoxin. Rotavirus has got enterotoxin. In incubation period, 0.5 to 2 days, يعني that is to say, a very short duration period, very abrupt vomiting and diarrhea. Clinical picture almost similar to the rotavirus. Norovirus are called winter vomiting bug in UK. If you say winter, it means noroviruses. You get more vomiting than in the sapoviruses, the other genera of these viruses. No vaccine is available, unfortunately, against noroviruses. Astroviruses, النجمية زي النجمة. Family, Astroviridae. Shape, it has 5 to 6 pointed stars. Usually it causes mild disease in infant and children. Again, naked virus, positive sense RNA, spherical, acid stable, heat stable, and also resistant to detergent and lipid solvent. Transmitted by fecal-oral route. In incubation period short, 1 to 2 days. The virus infection usually mild, but may last longer. Adenoviruses. يعني لو واحد يتقن التيبل البداية اللي حكينا فيه، كل هذه معلومات تفصيلية عن التيبل. Adenoviruses حكينا double stranded naked capsule virus account for 5 to 15%. عندنا سيروتا adenoviruses أريدكم تعرفوها، رقم 40 41 و 38. These are very important. Mainly it occurs in infant and children less than 2 years. In incubation period حكينا long 8 to 10 days. Duration of the illness here is usually 5 to 12 days. Diagnosis on the same way. Detection of viral antigen, virus isolation, serology. A treatment and the prevention similar to other measures, almost supportive measures. يعني fluid and electrolyte replacement على رأس القائمة. دائما نحن نخاف من الديهايدريشن. Now we come to parasitic causes of diarrhea. راح نتكلم على 3 parasites: Giardia lamblia, Cryptosporidium Pentidium coli. Starting with Giardia lamblia, also can be called Giardia duodenale or Giardia intestinalis. So remember these names also. These are more recent names than Giardia lamblia. Giardia duodenale and Giardia intestinalis. These are flagellate. عندها flagella. Vegetative form and cyst form. So we are going to talk about a trophozoite and cyst form. It has face appearance, a trophozoite, similar to the face. Look at it, face-like. It has 2 nuclei, nucleus and nucleus, and 2 central parabasal. These are the parabasal bodies at the end, 2 of them, and 2 axostyle. These are the parabasal bodies, the black one. These are 2 axostyle, the longitudinal one. These are parabasal bodies, the black one, and these are the axostyle, and they are flagellate. These are the flagella side. They have got 4 pairs of flagella. Okay, so 4 pairs, you can count them. They reside in the duodenum and the jejunum. If you would like to look at them, you have to look at them in the duodenum and the jejunum. Sometimes even we can make a duodenal aspirate if we don't detect the giardia in the stool and difficult to detect it, and we can do a duodenal aspirate. The cyst form, this is the cyst form, has 4 nuclei. Look at them. The parabasal body are also present. The axostyle also present in the middle, these 2 lines. But remember, 4 nuclei in the cyst. The cyst can be trophozoite, and the trophozoite can lead to cyst. You can see the trophozoite here with the staining in the stool. Very clear. 2 nuclei, similar to the face. Clinical capsule, Giardia intestinalis. Giardia intestinalis acquired from the environment, from food and eat, and is most often symptomatic. It occurs in the form of 4 weeks, and the stool will be full smelling, رائحة كريهة, greasy. It is one of the causes of malabsorption. That is why it causes a greasy stool. Abdominal pain, nausea, vomiting may also be present. And also characterizes by gases in the abdomen. غازات كثيرة بالبطن. يعني أنت تسأل المريض, a lot of gases in the abdomen. Clinical manifestation, 2/3 of the cases are asymptomatic in endemic areas. Acute symptoms begin 1 to 3 weeks after exposure. Diarrhea, sudden, explosive, stool full smelling, greasy, as I said, floating in the toilet. No blood, no mucus. It is malabsorption. Flatulence, distension of the abdomen. It's called the flatulence. Diagnosis, you find the cyst in the formed stool. Trophozoite can be found in the diarrheal stool. In the formed stool, you look for cyst. Although this is not absolute, a duodenal secretion, a duodenal aspirate, a jejunal biopsy sometimes can be used. To diagnose acute samples, consecutive and stem, chronic cases, weekly stool examination for 4 to 5 weeks. 4-5 أسابيع واحد ورا الثاني بالكرونيك كيسز. إذا أول واحد مو بوزيتيف ثاني الثالث إلى أحد 5. Also we can use enzyme immunoassay for a specific stool antigen. Immunofluorescence also for detection of Giardia in the aspirate, in the biopsy, we can use immunofluorescence. Treatment, there are varieties of drugs. Quinacrine, it can give a lot of cure, up to 95%. مترونيدازول اللي هو الفلاجيل عارفيه كلكم. مترونيدازول also can give high rate of cure. Furazolidine for pediatric liquid هذا. بارومومايسين بالبريجنسي. لو سألتك شو أفضل دواء, شو الفيرست لاين بالتريتمنت بالبريجنسي بالجياردياسيس, you will say to me paromomycin. A close contact also should be treated لأنه person to person spread is possible. Close contact should be treated also. الأهل كذا should be treated. Cryptosporidium. So we are going to talk about the Cryptosporidia, hidden spores. Crypto in the crypt. This is why it's called hidden spore. This is obligatory intracellular parasite. It is zoonotic, transmitted from animal. Cryptosporidium parvum and Cryptosporidium rural and urban strains. Morphology. We get oocyst, small spherical spores arranged in rows in a clinical specimen, يعني من during pathology, arranged in rows along the microvilli at extracytoplasm intracellularly. Extracytoplasmic, but intracellularly. That is to say, beneath the membrane, stained by Giemsa and hematoxylin, or special stain called modified acid fast stain. Remember, modified acid fast stain is used to stain a cryptosporidium. راح أشوفكم صورة إلى replication are acid fast with 4 sporozoid. عندها 1 2 3 4 4 sporozoid inside oocyst. Oocyst, as I said, small spherical. هذا هو small spherical. شو بداخل الاوسيست؟ سبوروزويد. 4 سبوروزويد. كيف نتعامل معها؟ اما بالجمزة هيماتوكسلين، والافضل وراح نشوف الموديفايد اسيد. قبل ما ابدا بالكلينيكال كبسول، تذكروا انه الكريبتوسبوريديوسيس عاده يكون بالاميونو كومبرومايزد، يصير بالشخص العادي، بس احنا اهتمامنا به هسه مرضى الايدز كثير منهم ينصابون بالكريبتوسبوريديوم infection, which is called the cryptosporidiosis. It is intestinal illness, comes from animals. And watery diarrhea, vomiting, weight loss. Spontaneous recovery is the usual outcome. However, exception for this rule in immunocompromised, like in AIDS patient, very susceptible. It can take a long time, this cryptosporidiosis. Or debilitating illness, شخص مريض كلش. Diagnosis, acid fast. Mycobacterium modify immunofluorescence to detect the oocyst. If negative, we do concentration method of the stool. Immunofluorescence and enzyme immunoassay anti-cryptosporidial antibodies can be used in these tests for the detection of cryptosporidium. This is the modified acid fast stain. These oocysts look at them, purple or red in color. This is the Cryptosporidium parvum. Treatment usually self-limiting, as I said, just supportive, fluid and electrolyte. In immunocompromised, we use paromomycin اللي ذكرناه بالجيارديا قبل شوي بالpregnancy, and nitaxoxide, nitaxoxanide, also antiviral for patients who are above 1 year of age. It has a cure rate of 80%. Nitaxoxanide.
دكتور
نعم.
الأدوية مطلوبة؟
اسم يعني هذا شو مطلوب يعني ما يعني
مو-
اسم وهاي كلها تكرر. هسه تشوف من نيجي على الهيلمنث نفس الأدوية، جيارديا نفس الأدوية، بالأميبياسز يعني كلها 7-8 أدوية، مو يعني مش محرزة.
تمام.
يعني ما نقدر نقول أنه يعني لابد أن تعرف أنه بارومومايسين، نيتاكسوكزانايد ما كثيرة، يعني ما راح يكون عندنا أكثر من at the end أكثر من 10. فسهلة كلش وكلها مكررة يعني. The last parasite, Balantidium, and the disease Balantidiasis, Balantidium coli. It is the only ciliate that can cause a human disease. You know what's the meaning of ciliate? It has cilia around it. It's a protozoa. It's present more in pigs. That is why these are zoonotic. These are not important in the Middle East, but some areas who harbor pigs may be important. This can be transmitted by, they can contaminate drink, water, and by cyst. Balantidiasis can cause gastrointestinal infection, mainly of the colon. Remember, this is colon infection, causing diarrhea or dysentery with nausea and vomiting. NV, nausea, vomiting. Treatment, standard care of patient. You can use تترازول. شو ميترونيدازول؟ يعني فلاجيل. يعني هلا كررنا الفلاجيل بالجيارديا، هسه بالبلانتيديوم ايضا فلاجيل اللي هو الميترونيدازول. تمام؟ tetracycline and flagyl. So it is zoonotic disease comes from pigs من الخنازير. Any question?
دكتور البلانتيديوم كولاي ما بقدر أعتبره من الإشريشيا كولاي ولا لا؟
له علاقة مع شو؟
مع الإشريشيا كولاي اللي أخذنا قبل
يعني
ولا لا؟
ذيك بكتيريا. والله بكتيريا، هذا باراسايت، هذا بروتوزوا. أريدك ترجعي على معلوماتك بالباراسايت. الباراسايت تقسم إلى بروتوزوا، إلى فلاجيليت، إلى آخره. ها؟ فالباراسايت إشي والبكتيريا إشي. إشكريشيا كولاي ذيك بكتيريا. وراح نجي على باراسايت آخر اسمه انتميبا كولاي. كولاي it means from the colon. It's not related to the type of the bacteria or parasite. Clear?
تمام.
تمام. Any other question? Please you go today and read the types of parasites in your general microbiology book. Just spend 5 minutes only and you will learn them. Other question? If not, we are going to conclude this lecture and hope to see you next time inshallah. حمزة كامل تسجيلك؟
دكتور كامل.
تمام.
سامعني؟
اوكي then.
تمام، يعطيك العافية.
الله يعافيك.